today's World Insight, Wuhan's count of COVID-19 cases and deaths raised. What the new data mean for global efforts against the pandemic. A rise in geopolitical tensions despite the need for cooperation. Why?
For COVID-19, we should also ask American and Chinese scientists to work together.
And there's nothing like the universal language of music to bring together people from around the world. One renowned Chinese concert pianist is doing his part in this effort.
I think as a human being, we need music, we need great, kind of emotion being together.
Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you from Beijing. I'm Tian Wei. We start today's show with the latest in China on the COVID-19 pandemic. The city of Wuhan, which used to be the epicenter of the outbreak in China, has revised its number of confirmed cases and death toll today. Over 300 cases have been added to the total infections, and over 1,200 more coronavirus-related deaths have been confirmed. Take a look at the updated numbers.
Wuhan has raised its COVID-19 tally. The pandemic killed more people than earlier known. Authorities report 325 more confirmed infections, which brings the overall number to 50,333. There are an additional 1,290 deaths. That puts the fatality tally in the city at 3,869. The rise of the death toll has drawn wide discussions. When asked about the reason for the revision, Wuhan authorities said due to limited hospital capacity and the shortage of medical staff, some patients were not treated at hospital. Also, a few medical institutions failed to get in touch with local disease control and prevention systems in a timely manner, which resulted in the delayed reporting of confirmed cases and failures to count patients accurately. Worldwide, confirmed COVID-19 cases have surpassed 2 million. The WHO rang the alarm bells with some European countries who are preparing to ease their pandemic restrictions.
And now we are joined by Liu Yuanli, the Dean of the School of Public Health for Peking Union Medical College. Professor Liu, welcome to our program.
Glad to be on your program.
Immediate response from you about the adjustment of numbers in terms of confirmed cases and deaths regarding Wuhan today.
This is not the first time the numbers coming out of Wuhan got updated and adjusted. I remember back in February, I think it's February 12th, the number of confirmed cases got updated by quite a magnitude because of the changing of the diagnostic criteria. So this time, I think, of course, I found it not surprising, but what's remarkable of the new update is that the death toll is increased by almost a third.
Yes.
That, of course, is due to several reasons, largely legitimate, because, as we know, Wuhan is epicenter, is the first epicenter of this pandemic. It's also the knowledge center. We are literally learning about our enemy while fighting the war. So the statistics, especially the underlying causes of death, will take some time and take efforts to get a firm handle on this. But, as an old saying suggests, it's better to be late than sorry. I think now updating this very relevant and important information is expression of China's responsible and scientific attitude towards developing a comprehensive understanding of this new disease.
Professor Liu, about the death rate. Now, we see, as you just suggested, the increase of 1/3. That's quite a huge number. What does that mean in terms of people's knowledge about different cases of death during that period of time of the outbreak in Wuhan, now in retrospect?
We know very early on that this new disease is very infectious. The basic reproductive number or index. That is to say, without any intervention, one person would affect how many other persons. So the latest estimate of the basic reproduction index is between 2 and 3. So by that number, would only take 21 days for the 8 billion people on this planet to be all infected. But how fatal, how vicious this disease, I think the scientific understanding of that question is still evolving. Therefore, the latest statistic coming out of Wuhan is very important. And this update is translated into the increase of the original estimate of case fatality rate from 5.1% to 7.6%. So an increase by 2.5 percentage points. So that has very important implications for the global anti-pandemic policies. You see, that basically means for those countries who have been contemplating about adapting a more passive approach to the war against COVID-19, namely mitigation and give the population a chance to develop a herd immunity. And if you adopt that policy, and the human costs will be enormous. Because now we know from the latest statistic that this disease is not only infectious, but very, very much more vicious than we previously thought.
Professor Liu, the latest I checked, the city of New York, which is the epicenter for the United States, has today more than 450 deaths per day. Now, this gives us a lot of thought about when it comes to the spreading of the virus and the development stages of the virus, as well as the measures of prevention, control, mitigation being taken, the timing of it, and the strictness of it. How much will all of these factors have an impact on the eventual number of deaths?
As the founder of medical economics, Ken Arrow, who is a Nobel economic laureate, pointed out, medicine is about decision-making under uncertainty. There are a lot of uncertainties about the diseases, and we practice medicine according to the latest evidence, and the evidence is evolving, is dynamic, so our practice will be adjusted accordingly. That's why among the 4 principles highlighted by President Xi Jinping, determination, solidarity, science, and precision. And among the 4 principles, science-based approach and the precision medicine is really called for. Now, that's a very lofty goal, but we are learning as we are doing it. And early on, China classified confirmed cases into 4 categories: mild, ordinary, severe, and critical. So China developed a differentiated treatment protocol and guidelines depending on what category, what stages a patient is at. Particularly, China has learned a lot of useful lessons about early intervention, about combining the Western and traditional Chinese medicine to boost up the immune system at early stage, and trying to block the overreaction of a human body's immune responses at a later stage. So all those important clinical information experiences are now being shared by the Chinese clinicians with their international counterparts.
How should we understand information and facts as far as you could gather vis-a-vis information and facts in retrospect, Professor?
In the field of science, we make careful distinction between data, information, and the knowledge. Okay, so what we are aiming at is generating meaningful and actionable knowledge based on data, facts, and organized information. And as the availability of data improves, of course, our analysis and our judgment, our conclusion, and our body of knowledge will be expanded accordingly. So transparency is very important in this business. Transparency assumes that we know everything we need to know. But in the real world, that's not. So we should tell the world what we know for certain, but we also should tell the world what we don't know and we like to know. And we will keep the scientific community, our clinicians, and the public at large posted as our information becomes more available. So that's the honest, frank, and scientific approach for communication and sharing of information.
Professor Liu, we've seen the adjustment of numbers, or rather the updates of numbers, both of confirmed cases, suspected cases, as well as death rates being done in several countries and in several epicenters. Are we expecting these numbers to change for the near future? Because that would, in a way, help us to get a better understanding of exactly what is the nature, or rather to nail down the nature of this virus.
I think it's only rational to expect those numbers to be adjusted and changed over time as more information become available. And you see, the latest example is in New York. The Governor Cuomo estimated initially that there is overwhelming of the healthcare system and so on and so forth. But as it turned out, the healthcare facilities were underutilized, the ICUs and the emergency rooms and so on and so forth. So that's a good news. But sometimes we can also underestimate the seriousness of the pandemic. So because, like I suggested, medicine to begin with is a science and art under uncertainty.
Right.
And it is especially true with regard to a novel virus and a new disease such as COVID-19.
Thank you so much, Professor Liu Yuanli, the Dean of the School of Public Health from Peking Union Medical College.